Hello and welcome back everyone. This is Mr. Nikul and you are at the channel Cool Professor Nikul. So we are in continuation with a previous video that is antibiotics, and now we'll be starting the category that is macrolides, under which we'll be studying erythromycin and azithromycin. Okay, so let's study both of them. First, stability and storage of erythromycin. It is to be stored in a light resistant container, and then the uses are mainly to treat the infections of this patient who are allergic to penicillin. That is, the patients who all are allergic to penicillin, to those erythromycin is given to treat the infections. Then it is the drug of choice to treat pneumonia, urethritis and pelvic inflammation. Then it is also used to treat amoebic dysentery. Then the formulations in which erythromycin is available, that is in the erythromycin gastro-resistant tablets, then erythromycin steroid tablets, erythromycin injections are available, and soluble powder is the another form of formulation of erythromycin. Then the popular brands under which the erythromycin is marketed is mainly erythrocin and althrocin. Now let's see azithromycin. Azithromycin, it is also stored in a well closed container. The uses are mainly against the gram-negative bacteria, while it is also used in treatment of respiratory tract infections, urogenital and other sexually transmitted infections, that is STDs. Now the formulations of azithromycin are mainly capsules, tablets, oral suspensions and injections. The popular brands under which erythromycin is marketed is mainly Zithromox, Azitral, Azivox and Azivin. Okay, thank you and have a good day.